Hello friends, welcome back to Complete Medical Coding. Today I am here with more mock questions. Those few questions which are very important and has asked in the previous year examination. Okay. So friends, if you are new to the channel, please subscribe and thank you so much for all your support. Let's move to the questions. Let's have a look into each and every questions one by one. So let's move to the first question. The patient had a torn medial meniscus. An arthroscope was placed through the anterolateral portal for the diagnostic procedure. The patellofemoral joint showed some grade 2 chondromalacia on the patellar side of the joint only, and this was debrided with a 4 mm shaver. The medial compartment was also entered, and a complex posterior tear of the medial meniscus was noted. It was probed to define its borders. A meniscectomy was carried out back to a stable rim. Select the appropriate CPT codes for this service. So what is the procedure done here? Meniscectomy. Meniscectomy of patella. Patellofemoral joint. Where is the patellofemoral joint located? It's in the knee. Okay. So because in the CPT codes you might not get the exact anatomy, the exact patella. It will be in the on that portion, main portion, which is in the knee. So what procedure is being carried out here? Meniscectomy of the knee joint. Okay. Let's move to the CPT codes one by one. If you look in the series, what are the codes, main codes? I mean, the series of the codes is starting from 29877, 879, 880, and 881. Anyway, let's look into the first CPT code, 29880. Okay, let's look into 29880 and 881, which is the main CPT codes in all the options. So go to 29880. 29880 is arthroscopy knee surgical with meniscectomy, medial and lateral, including any meniscal shaving, including debridement or shaving of articular cartilage, chondroplasty, same or separate compartment when performed. And what is 29881? Same, arthroscopy knee surgical with meniscectomy, medial or lateral, including any meniscal shaving, including debridement or shaving of articular cartilage, chondroplasty, same or previous compartment when performed. So what is the difference between these two codes? 29880 it is meniscectomy medial and lateral, and 29881 is with meniscectomy medial or lateral. Okay, so you need to check in our question if whether both the sides like medial and lateral is done or medial or lateral is performed. Either one is performed. Yes, it is only medial performed in our question, right? Medial meniscus was noted. Almost in the third last sentence you can see the medial compartment was also entered and a complex posterior tear of the medial meniscus was noted. So meniscectomy was done on the medial side. So if it is only one, you need to use the code 29880. If in the question it is mentioned both medial and lateral, then we have to go with the code 29880. So here our answer will be option D, 29881, because meniscectomy only medial is performed. Okay, that's how you need to check the code. Now let's move to the second question. A 34-year-old female was scheduled to undergo an elective repeat C-section in next 2 weeks. Instead, at 36 weeks, 3 days gestation, she is admitted for premature rupture of membranes and is taken to the operating room where she delivers by C-section. A 6 lb 4-ounce boy baby was delivered without any complications. Both baby and the mother are doing well. What ICD-10-CM codes are reported? So this is an important question. You will be getting such type of questions, maternity questions, pregnancy questions, definitely in your CPC examination. Okay. So here the patient is 36 weeks and 3 days gestation. The patient was scheduled to undergo a repeat C-section. It means her previous delivery was also C-section. Okay. So repeat C-section, the second or whatever it is, the next C-section in the next 2 weeks. It was scheduled in the next 2 weeks, but unfortunately at 36 weeks and 3 days, she was having a premature rupture of membranes and is taken to the operating room, where she delivered through C-section, and the boy baby, she delivered a boy baby weighing 6 lb 4 ounce, okay, without any complications. Both are having no complications. So currently, what will be the first first diagnosis that we need to code? For pregnancy, always you need to use O code as the primary. Okay, this you will be getting interview questions also like this. What will be the primary code for maternity or for pregnancy? Okay, always you have to code O code. So here, what is the complication or what is the condition of the patient? Rupture of membrane. So that we need to code first. First, you need to code for the rupture of membrane. Then you need to code for the number of weeks of gestation, and then whether it is a live birth or stillbirth. That will be the third code. This will be the order of the codes. Okay. So first you need to code for the complication. What is the patient here for? So let's find out the O code first. Okay. So what is O42.919? O42.919 is, you can go to the O codes, open the ICD book and go to the O codes. O42.919 is preterm premature rupture of membranes unspecified as to length of time between rupture and onset of labor unspecified trimester. No, we know the trimester because 36 week is third trimester, so this is wrong. What is O82? Encounter for cesarean delivery without indication. What is O80? Encounter for full term uncomplicated delivery. What is O42.913? I'm just explaining the O code first, okay? O42.913, preterm premature rupture of membranes unspecified as to length of time between rupture and onset of labor, third trimester. Yes, since we have an exact trimester or the exact description of the ICD code, that one you need to select. So O42.913 is our correct O code, because the preterm rupture of, this is not a preterm baby but still preterm rupture of membrane, premature rupture of membrane, third trimester, because it is 36 weeks. So you need to use this code as O code. So we already got the correct option as option D. Still, let's look into the other, what are the other ICD codes here in option D. Z3A.36, which represents 36 weeks. If it is 30, even though if it is 36 weeks and 3 days, you cannot code it as 37. You need to code it as 36 only. Okay. So Z3A.36 represents 36 weeks of pregnancy, and Z37.0 is the code for single live birth. Z37.0, it always represents a single live birth. For delivery, you must code the live birth, whether it is single live birth or twin birth, twin delivery, whatever it is. Okay, that should be the final. Anyway, O code should be the primary. So we got the answer as option D, O code primary for the preterm premature rupture of membranes in the third trimester. Z3A.36, which represents 36 weeks of gestation, and Z37.0 represents single live birth. Okay. So friends, let's move to the third question. A 50-year-old male with a BMI of 45 has uncontrolled diabetes and hypertension. HTN represents hypertension. Okay. Failing non-operative obesity interventions, the decision has been made to perform gastric banding. A laparoscope along with 4 to 6 trocar ports are sited through the anterior abdominal wall above the umbilicus. The silicone gastric band is placed and secured around the upper stomach to form a smaller pouch with a narrowed outlet. Tubing is attached to the band and tunneled through the abdominal wall, connecting it to an access port. What CPT code should be used for this procedure? So here, what procedure is being carried out? It's a laparoscopic procedure, right? Because in the third line it's mentioned laparoscope along with 4 to 6 trocar parts are sited. So it means laparoscopic procedure. and gastric banding is the procedure done here. Anyway, let's directly move to the options one by one. What is 43634? The first option for CPT code 43634. Gastrectomy partial distal with formation of intestinal pouch. This is not gastrectomy procedure, it's laparoscopy. So you need to find out the code for the laparoscopy, okay? 43635, sorry, 43645. What is 43645? Laparoscopy. 43645 is laparoscopy, surgical, gastric restrictive procedure with gastric bypass and small intestine reconstruction to limit absorption. Gastric bypass, no, this is gastric banding. Both are different, okay? What is 43770? 43770. Laparoscopy, surgical, gastric restrictive procedure, placement of adjustable gastric restrictive device. Example, gastric band. Yes, this is what we need. Gastric band and subcutaneous port components. So this is the laparoscopy procedure of gastric band, which is our correct answer. If you want, you can just check the other code also, 46250. 46250. What is 46250? 46250 is hemorrhoidectomy. No, that's wrong. So our correct answer is option C. As I told you, 43770. Laparoscopy surgical for gastric banding. Okay. Now fourth question. A patient presents to the physician's office with complaints of dysuria and slight nausea. The physician thinks she has UTI and performs a non-automated urinalysis which came out negative. The appropriate coding for this encounter would be. So here the patient is, see, this is an important question because such type of questions you might get in either examination or in future in your interviews. Because see, what are the complaints of the patient? Dysuria and nausea. The physician thinking that she might be having UTI, urinary tract infection. UTI means urinary tract infection. The doctor performs non-automated urinalysis, but the result came out negative. It means there is no UTI for that patient. So if in the question, if it is not a confirmed diagnosis, you cannot code UTI. Instead, you need to code only the complaints. Okay. Anyway, first let's find out the CPT code. What is 81007, 81002, 81000? You need to find out the code for non-automated urinalysis. Let's find out what is the code for non-automated urinalysis. 81000 is urinalysis by dipstick or tablet reagent for bilirubin, glucose, hemoglobin, ketones, leukocytes, nitrate, etc. etc. Non-automated with microscope. If it is with microscopy, it will be mentioned in the question. Here it's not mentioned, so it means it's without microscope. Okay. And 81002 is non-automated without microscopy. And 81007 is urinalysis, bacteriuria screen, except by culture or dipstick. That's wrong. So the answer, the exact CPT code will be 81002, which is urinalysis by dipstick, non-automated without microscopy. Okay. So if it is microscopic procedure, for sure, definitely they will mention it in the question. Like for example, if there are two different codes for with using microscope and without using microscope, in such cases they will mention. So here the correct CPT code will be 81002. Okay, which is in options B and C. Now you have to code for. You should not code for UTI because it is not a confirmed diagnosis. Physician was only having a thinking that she was thinking that the physician thinks that the patient might be having UTI, but since the result came out negative, the patient doesn't have UTI. So you need to code the diagnosis as the complaints, which is dysuria and nausea. So in option B, if you go to option B, R30.0 represents The ICD code R30.0 represents dysuria and R11.0 represents nausea. Okay. For making you confused, they have given in option C N39.0. N39.0 means UTI. N39.0 is the diagnosis UTI. But you cannot code. If in the question it is the result came out positive, then the answer, what will be your answer? Then your answer will be 81002 and N39.0. Then you should not complain. You should not code the complaints. You need to code only the confirmed diagnosis. If the result was positive or if the diagnosis is confirmed, then you need not code dysuria and nausea. Then you need to code only 81002 and N39.0, which is UTI. But now in this case, since the result came out negative, you cannot code that. You need to code only the complaints, dysuria and nausea. So the answer will be option B, 81002 for urinalysis, non-automated, without microscopy, R30.0 for dysuria and R11.0 for nausea. Okay. Now let's move to the fifth question. The 15-year-old patient is being seen for physical therapy. She has an abnormality of gait and speech problems that are both sequelae of viral encephalitis, for which she was hospitalized last year. The encephalitis was caused by the measles virus. The measles virus has been resolved. What ICD-10 CM codes are reported? So here you need to code only the ICD. What are the diagnoses here? It's clearly mentioned in the second sentence. She has an abnormality of gait and speech problems. So you need to code for gait because the patient is for physical therapy. You need to code all the diagnoses. Gait and speech problems. These are the complaints that are both sequelae of viral encephalitis. Sequelae of encephalitis caused by measles. But the measles virus has been resolved. So you need not have to code for the measles virus. You don't need to mention measles virus because it was resolved. Currently the patient is having viral encephalitis. And then abnormality of gait and speech problems. For that the patient is here for physical therapy. Okay. So let's find out the answer, the codes one by one. The first one, B05.0. What is B05.0? Measles complicated by encephalitis. See, to make you confused, they have given this code, measles. It's mentioned in the question that the encephalitis was caused by the measles virus, but the virus has been resolved. So it means you don't have to code that. Okay, so that will be wrong. You need not code that one. So let's move to option B, which is same as in option A also. R26.1. What is R26.1? Paralytic gait. Yes, you have to code for the gait because the patient is right now here for physical therapy. You have to code gait and speech problem both. Gait, these two, either of these two should be the primary diagnosis. Okay. So gait R26.1, and what is R47.9? Speech disturbances, unspecified speech disturbances. You can check the HD book, you will get it. Okay. R47.9 is speech disturbances. So either of these two should be primary diagnosis because the patient is here for physical therapy. Now what is B94.1? B94.1 represents sequelae of viral encephalitis. Yes, that is also mentioned, right? She has an abnormality of gait and speech problems that are both sequelae of viral encephalitis, for which she was hospitalized last year. So this gait and speech problems was caused because of the sequelae of viral encephalitis. So you need to code for sequelae of viral encephalitis because of that the patient got these two complaints. So you have to code that as a history. Like the patient was not history, you cannot say history of viral encephalitis because of that only the patient is right now coming for physical therapy, right? For gait and speech problem. So you have to code for as a secondary diagnosis sequelae, not secondary, I mean the last code as sequelae of viral encephalitis. That will be B94.1. So that also you need to code. and you should not code for measles because measles virus was already resolved. So if you want, you can check the other codes in option C, B05 and everything. But since we got the correct answer, the first one, ICD code for gait, R26.1, then speech problems, R47.9, and sequelae of viral encephalitis, B94.1. So the correct answer will be option B. Okay, either of R26.1 or R47.9. Either of these two should be primary. You can code it anyhow. And then B94.1 for the sequelae of viral encephalitis. Okay. So friends, these are few important questions and guidelines from the examination, CPC examination. If you find this video useful, please like and share. And any queries, you can mark it in the comments. So let's come back again with more questions. Stay tuned. If you are new, please subscribe to my channel. Thank you so much for all your support. Take care. Bye.